Thank you. All right. Afternoon, everyone, and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Kimani Hendricks, and I am the Multimedia Communications Coordinator for the foundation. And this afternoon, Dr. Herb Karpatkin will be answering your physical therapy related questions for the next hour. So if you haven't been with us before and you don't really know how the town hall conferences work, you can either type your questions into the chat or the Q&A features on Zoom if you are watching us from there. And if you are on Facebook, you can also type your questions into the comment section below the live stream. But right now, let me just introduce the doctor. So Herb Karpatkin received his master's degree in physical therapy from Boston University and a doctorate in neurology from Rocky Mountain University. He's board certified in neurology and geriatrics clinical through the American PT Association and is a certified multiple sclerosis clinical specialist through the Consortium of MS Centers. He has held clinical posts at the Rusk Institute of Rehabilitation Medicine, Burke Rehabilitation Hospital, the International MS Management Practice, and academic posts in the physical therapy departments of Touro and Hunter colleges. He has presented extensively both nationally and internationally on physical therapy and MS, and has published articles on multiple sclerosis in the Journal of Neurologic Physical Therapy, Archives of Physical Medicine and Rehabilitation, International Journal of Multiple Sclerosis, and Multiple Sclerosis International. He's the recipient of the 2015 American PT Association Award for Excellence in Neurologic Education and the 2019 National MS Society Research Partners Award. In addition to continuing to be actively involved in patient care, Dr. Karpatkin is a tenured associate professor of PT at Hunter College, City University of New York, teaching courses in neurologic evaluation and intervention, psychosocial aspects of healthcare, and research design. And Dr. Karpatkin, I am going to turn it over to you and give myself a minute to catch my breath, but it's good to be with you this afternoon.
Well, thank you very much, Kamani. It's good to be here. I think we have to work on making the introduction a little bit shorter. It's cutting into the time. Folks, I'm here to answer questions about MS and exercise or MS and physical therapy. I've been a PT for going on 40 years now, and one of the reasons I do this work for the MSF is because I feel exercise and physical therapy are incredibly underutilized by persons with MS, and I think that there's a way that you could improve the quality and quantity of your life if you have MS by getting involved in a good exercise program put together by a physical therapist.
So we do have one question from Diane. She asks, what is best for knee hyperextension?
Okay, well, that's a great question. I see it with a lot. I see what can be called hyperextension in many patients. I want to make sure that what you have is hyperextension. Does it mean that your knee snaps back when you walk? Or does it mean that your knee goes too far in one direction? If it means that your knee snaps back, which is what I assume you mean, even though it's happening at your knee, that usually occurs as a result of tight calf muscles. Okay, the tightness of the calf muscle. Yeah, thank you, Diane. That answers my question. It snaps back. That's actually not knee hyperextension, but if it remains untreated, it will start to hyperextend. What's happening to you is actually called an extension thrust. And even though it's happening at the knee, the problem actually originates from your ankle. I'm quite sure that the muscles of your calf on that leg are probably very, very tight. And the more you can stretch out that calf muscle, the less that knee is going to snap back. So, and the tightness of calf muscles is probably one of the most common things I see as a PT working with people with MS.
I am going to switch over for a second. We have an attendee with their hand raised, and Jan. If you can unmute yourself and just ask Dr. Karpatkin your question when you're ready. Jan, are you there? The raise hand feature is always so tricky because you can't see it from their perspective, so you're not sure if they're trying to raise their hand or not. But hold tight, Jan. I'm gonna come back to you. Joe asks what the best exercise is to strengthen legs after Botox injections.
Um, that's a difficult question because I need to know where the injections were, what muscles were injected, and where the weakness is. Botox is a way of dealing with hyperactive tone or hypertonicity in a muscle, which happens a lot in MS. The muscle itself is injected and that makes the muscle relax. Usually, the reason that it's done is that Botox is given is because of muscle stiffness. So, what most people who I work with who have Botox injections do is I work on stretching out the area that was injected and then strengthen the opposing muscle group. So say, for example, your biceps was injected, okay? That is going to make it easier for you to extend your arm. So you should stretch out that muscle, but you should also strengthen the opposing muscle group, the triceps. So the easy answer to your question is whatever muscle is opposing the muscle that was injected is the muscle you should strengthen.
We have another question from Julie. She says, I was attending an MS yoga class. They've now closed it. I felt it was helpful. Do you agree? Thanks.
Hard to say without knowing why you felt it was helpful. A lot of people with MS like yoga. It's has a lot of things going for it for persons with MS. First, it is based on relaxation. Um, it is based on posture. It is based on flexibility. And these are all things that can benefit most people with MS. Um, most everybody I know with MS who's tried yoga has found it to be helpful in some ways. By itself, it's not enough. Okay. If you're having trouble walking, yoga is not going to do a great deal to help your walking or your balance, but it will aid in your flexibility and posture, which can have an impact on it. But if you found yoga helpful and now you're not doing yoga, then it is in your best interest to find another way of getting to it. If yoga was helpful to you in the past, you should keep doing it. Exercise is always better than not exercising.
I did want to just tell Julie, I'm not sure if you are aware, but the Multiple Sclerosis Foundation has weekly chair yoga classes available on Zoom. You can either go on our website, msfocus.org, in the events tab and register for the chair yoga classes. They're on Monday mornings at 9:30 p.m. 9:30 a.m. I'm sorry, Eastern time. And on our YouTube channel, we have several of those pre-recorded classes already uploaded. So it's not just chair yoga, but it's also Tai Chi and things like that. So I hope that helps. Tanya has a little lengthy question here, but she says, what can I do to strengthen my left leg? My medical provider stated that my left quad and hamstring is weak, even though I go to the gym weekly to help with the process. This is um, this is all after having a total knee replacement and knee surgeries. Any answers will be appreciated.
Was the weakness immediately after the surgery or Was it there before the surgery? I've worked a lot with persons with total knee replacements, and there's usually a lot of weakness and stiffness afterwards. Um, Physical therapy is almost always prescribed after a total knee replacement. And if your quad hamstring are weak, which could certainly happen after total knee replacement, then exercises to isolate those muscles out are highly recommended. Um, I would like to know what muscles you're using at the gym, what machines you're using at the gym, but a knee extension machine and a knee flexion machine, even if you do it with the lightest weights and just do a handful of reps will help. But I'm wondering if there aren't other things going on there as well, like pain and lack of flexibility. If you have lack of flexibility and pain, it's going to make it hard to uh, do those exercises. So if you haven't already seen a PT for the knee, I strongly advise you do one. It's pretty straightforward stuff for a PT to strengthen a knee, a post-surgical knee.
Got it. Yeah, and I would also like to add that if there is something that's not quite clear to Dr. Karpatkin when we are addressing your question, you can just add it in the chat so that
Yeah,
it's a little clearer for him.
that would
Um,
really.
Anthony wants to know what would be best stretches for the upper back into the shoulders.
The upper back into the shoulders.
Yeah.
Um, can you maybe let's do what Kimani just suggested. Give me, is there a part of your uh, upper back or upper body that is tight? Um, Usually persons with MS, the reason why I ask is usually persons with MS, their upper back is way too loose. They're very hunched over. Um, is that what's happening with you, Anthony?
While we wait for a response, I'm not sure if Jan is still trying to ask a question, but if you are, Jan, just unmute at any time and wait until there is silence to come on in. So Diana wants to know what you think of vibration plates.
Vibration plates, sure. So a vibration plate or whole body vibration was a uh, machine that came out maybe, I don't know, 15, 20 years ago, where you would stand on on a plate which would vibrate at a certain frequency, like 60 vibrations per minute, more or less. And it was thought that it might normalize the motor system. It's been researched pretty well, and there's really no evidence that it does anything. When I used to have a private outpatient practice, I did get one. A few patients really liked it. A few, it actually made their symptoms worse. Um, so what I can say is from a research point of view, there's no evidence that it's helpful. If you get on it, it makes you feel better in some way, then I urge you to use it, but it's not something that I recommend because the research does not support it.
Barbara wants to know if you should seek physical therapy even if you don't have any current disabilities.
That is the best question. The short answer is yes. And the reason why is you want the therapy to be preventative rather than reactive. Okay. So if you start getting therapy before the symptoms appear, it can prevent the symptoms from occurring or at least forestall them. Okay. So consider this, about 90% of persons with MS or more state that their worst issue has to do with walking. At some point, they weren't having trouble walking. If they had started working on walking before the issues started, because a good PT can anticipate what's going to happen. Most persons with MS, before they have trouble walking, you notice that the muscles, particularly of their calves, have gotten tight. You'll notice that their balance is going to be very slightly impaired. And, excuse me. And you should really be starting to work on that before it becomes a problem, not after. I think it's one of the best things you can do.
Yeah, that actually kind of ties into a question that I had of whether or not you thought everybody who had MS should go up for PT. So I guess so.
Everybody with MS, so let's differentiate between PT and exercise. They don't mean the same thing. Exercise means anything, any repetitious activity that is done to gain fitness in some way. And it can be very, very global. So if you go for a 10-minute walk every day, that's exercise and you gain some benefit from that. But it's not PT. When a patient comes to see me, it's because they have very, very specific issues with their flexibility or their strength or their balance or their walking or their coordination. And the exercises that I give them are designed specifically for how the MS has impacted them. So physical therapy is very pointed and specific. Exercise is general.
Thank you
So,
for drawing the
does
line.
everybody with MS need physical therapy? I would say no, although everyone should be evaluated by one. But everybody with MS absolutely needs exercise. And let me tell you the reasons why. First of all, everybody in the world needs exercise. Okay. And so you will have a better life if you exercise than if you don't. Um, Second, and more important, there have been studies that have shown that people with MS who exercise regularly have a better course of the disease, of a better course of MS than those who don't. Literally, the disease attacks them less if they're chronic exercisers. And chronic in these studies is defined as 20 minutes 3 times a week, not a lot.
Hmm. Yeah, thank you for drawing the line between exercise and PT,
Yeah.
because I think that's very important. Anthony, who had asked about back and shoulder
Good.
stretches, he said mostly after sleep or sitting too much while at work. He does say that walking around helps after a while, but I guess his discomfort comes back. So he is trying to find the best stretching.
Okay, so I'm going to take a guess. If you're sitting for a long time, like many of us find ourselves doing, you're probably very hunched over, and you probably have. I imagine the pain is in the upper back and your neck. Um, that's pretty common scenario. And what I recommend you do is while you're sitting at your desk, maybe every 30 to 60 minutes, do the following stretch. And it's as simple as this. You pinch your shoulder blades together while looking up at the ceiling. It basically puts your upper body in the reverse position it was in when you were sitting at your desk. So pinch your shoulder blades together, look up at the ceiling, hold it for about 10 seconds. Do that 2 or 3 times every 30 to 60 minutes.
Nice. We have an
Excuse me.
It's okay. We have an anonymous attendee who asks, or they say, when I walk, my left foot turns outward. What muscle group controls this? I also use a psionic sleeve.
Um, it could be due to any reason. The it could be because it could be for dozens of reasons. Um, I'm wondering if the psionic sleeve is a excuse me, electronic device that stimulates certain muscles while you walk. And it could be that the psionic sleeve itself is activating a muscle that turns your leg inside, that turns your leg outside. Do you walk the same way? Does your ankle turn out when you don't use a psionic sleeve, or is it only when you use a sleeve?
They didn't say.
Well,
Okay. So Tanya says, I have been to PT and am continuously doing the exercises they're giving me. I use the leg extension and specific machines for the quads. What other things can I do in this regard after exhausting all resources?
what other things can you do for what? Um, okay, so let me make a rule here, guys, for asking questions. I really want to help you. And one way I can make sure that I do is when you ask me a question, don't just say, what's the best exercise? I want to know what is the problem that you're having? Is there a problem with walking, with balance, with pain? You need to give me more information if you want me to help you. So you use the machines. I wonder if you're doing any work on your balance. Are you doing any work on your walking? Are you doing any work on your flexibility? Most people with MS have, excuse me, problems with balance, problems with walking, problems with flexibility, and problems with strength. And your program, whatever your PT and exercise program is, it should be addressing those four areas.
I welcome those who are attending in Zoom specifically to utilize the raise hand feature that I mentioned because raise hand, I know a lot of people may be shy and don't really want to talk out, but that is also quicker, goes quicker than typing
And
it and then still having some missing pieces. And it's also
it'll allow me to help you better.
right. So we do encourage more raised hands as well. It looks like I skipped over Cindy, so I do apologize for that. Cindy asks, would you recommend, forgive me here, this is another reason why we like raise hand, so we can get rid of typos. Would you like to recommend using the massage on a bed when you're no longer able to turn at night? I don't know what that means, but hopefully you do.
Using a massage bed
The massage, she just says the massage on a bed. I don't know what that means.
to help turn at night.
When you're no longer able to turn at night, would you recommend? I don't know if I have no idea. I wish I knew, but
Um,
she's asking, would you recommend using something that massages on a bed when you're no longer able to turn at night? I have no idea. Here she is.
I
She's raising her hand. Thank God.
okay.
Cindy, can you unmute, please? Thank you for coming on.
I have an adjustable bed where you can raise the feet and the head, and there's also a
Oh,
massage function on the bed. Now that I'm no longer able to turn over at night to try to avoid pressure sores, I'm wondering if using that massage function on that type of bed would benefit me.
um, that's a great question. The short answer is no, I don't see how it would. It would just put areas of pressure on and off your back. Um, if I may ask, um, have you worked with a PT to help you with rolling? Because I literally just came from seeing a patient who claimed that she couldn't roll, and I and my students have been working with her, and by her fourth or fifth session, she's now able to roll. So, um, uh, I don't see how a massage function, unless it's a really, really strong massage function, can help you roll. But
It's not that it's going to help me roll, but it would give my body something other than just laying flat.
right.
Because
Um,
I'm now confined in a wheelchair and I live in assisted living.
right. So if you have a bed where the head and the legs raise and a massage function, probably the best thing to distribute the weight load so that you have a decreased risk of skin breakdown is to be raising and lowering the head, raising and lowering the legs, doing so that different areas of your body are going to be uh, bearing more or less weight. So for example, if you raise your head but keep your legs low, you're going to have more weight bearing on your head and less on your legs. If you do it the other way, you'll have more weight bearing on one side than on the other. So probably the best thing you can do if you just want to use the bed is to alternate the settings a lot. Probably a better thing, though, would be to be in a bed where the mattress itself guards against skin breakdown. And there's lots of beds. I would imagine the staff at the facility you're at would know about these beds. It's something a lot of my patients use. They're beds that are specifically designed to prevent skin breakdown.
Okay. Thank you so much.
Thank you.
Thank you, Cindy. I have, let's see, somebody says that they have hip flexor weakness and wants to know what they can do about that. What exercises work for that?
So if I can ask that person to tell me, in what way do you think you have hip flexor weakness? Usually hip flexor weakness means they can't raise their leg off, up in the air, either from a lying down or a seated position. Is that what's happening for you?
Diana, if you want to type that in or raise your hand, please do. And I'm going to jump back over into the Q&A. So someone says, I've been having lower back pain and spasms. Is there any exercise or stretches I can do to get relief? I'm totally mobile and don't use any mobility aids regularly.
That is a surprisingly common situation for persons with MS, low back pain. Again, it's hard for me to know exactly what's happening without doing an evaluation. But my guess would be, because this is what most of the MS patients I've worked with have experienced, that your low back is too flexed. So one thing that I recommend you try to do is to spend 5 minutes a day or so lying on your stomach, lying flat on your stomach to reverse the curve in your lumbar spine. Okay. And usually people have low back pain because they're too bent over at the waist. They either spend too much time sitting at their desk or they slouch when they walk. Okay. So lying on your stomach so that you're completely flat and just being in that position for a few minutes at a time could really help. I saw actually a patient a couple days ago, and that was his biggest problem. His back pain was so bad that he was having a lot of trouble walking, and it wasn't the MS, it was the back pain. And once we treated the back pain, what was thought to be a lot of his MS symptoms improved.
Got it. Diana has jumped back into the chat. She was the one asking for best exercises for weak hip flexors. I don't recall the question that you asked her, but she just says sitting.
Okay, so in sitting, okay. So here's usually the starter exercise I give people who have weak hip flexors. Okay. And I believe this is in the list of exercises that I've actually shared with the MSF that all of you will be able to access. But here's the exercise. So say it is your right hip flexor that's weak. You lie on your bed on your back with your right leg hanging over the side of the bed and the left knee bent, your arms at your sides, and then you try to lift your right leg up. Okay, so repeat it again. You lie on your back on the side of a bed, right leg hanging over the side, left leg bent and your foot flat, and then you try to raise your right leg in the air a few inches and then lower it slowly. That's usually one of the best starter exercises for hip flexor weakness.
Thank you. We have one more question in the Q&A. It's from Joe. He says, can you discuss why a PT would want to do a wellness program where I can come and go to use equipment as I want to? I feel doing a scheduled routine has no endpoint, because there is nothing to heal from, and that's why the PT says there's no need to do an appointment monitoring.
Oh, that's an interesting question. So there's a couple possibilities here. One is that the MS has not progressed to a point in you where it needs direct intervention from a PT, and the PT has determined that the best thing for you is just a generalized fitness program, which could be entirely appropriate. Alternatively, it could be that the PT uh, is not aware of problems that you have, or you haven't made the PT aware of these problems, and there's things that do need to be worked on, but the PT is not aware of them. If you're having trouble walking or balancing because of specific reasons, that should be seen by a PT. If you're having minimal or no mobility issues due to the PT, due to the MS, then a fitness program may be appropriate. And I know many people like that. There's a lot of people with MS who, even though they're diagnosed, their symptoms are relatively minimal. I mean, there was a guy who played in the NBA for a few years who had MS. So if you're actually having problems with your mobility and your gait and balance, and your PT is not addressing them, then you need to continue that conversation with your PT. If the PT, and I don't want to talk ill of anyone's PT, but if you're having problems and the PT is saying there's nothing to be done, then you probably need a different PT. Not in the same way that not all doctors are equivalent, not all PTs are equivalent. You all go, I imagine, to a neurologist to treat your MS, a neurologist who's probably trained in multiple sclerosis. You go to a neurologist. You wouldn't go to a dentist. You wouldn't go to a kidney specialist. You wouldn't go to a dermatologist. You go to someone who has expertise in your field. And it's the same way in MS. Now, I make this statement every time I give this talk, and I'll make it again. If you don't think your PT has enough expertise in MS, then you should find one. I will help you look for one, and this is something I do a lot. Kimani, you can share my email with the group, and you guys can contact me and let me know where you live, and I'll try to find somebody who can help you. That being said, if the PT doesn't know what to do, they can call me and I will train them for free. I have videos out, I've written papers. The information is available. Okay. There's no reason why any PT should not know the basics of treating MS, and there's no reason why any person with MS should not be receiving appropriate physical therapy.
Right, and I did want to address a comment of Dr. Adam Chaffetz is here, and he is pretty much saying what you said in some, that not all PTs have neuro or even MS training. So thank you for stressing that. And thank you, Dr. Karpatkin, for offering to help train the PTs, who may have little expertise, but are willing to learn and help, because I think that, and it's funny that Dr. Chaffetz is here, because I've heard him talk a lot about self-advocacy, and just being like, this is your health, this is your life. So if you have to find another specialist, do so. It's your body. And if something's not working for you, if you're still having problems after seeing the specialist, then you definitely should look elsewhere, because there is help out there. So I agree 100%. Um, I don't see any more questions in the chat or the Q&A, as far as I can tell. there are no questions on Facebook either. Dr. Karpatkin, did you have anything to add? Anything that has not come up, but you feel like
Oh,
is important to talk about until we
oh,
have some more questions?
well, I could talk on the topic for 24 hours straight and still have plenty to do. Let me talk a little bit about some of the research that I'm doing with my doctoral students at Hunter. So with the summer coming up, it's all of you know, of course, how difficult heat can make your lives. So in that, on that topic, let me tell you about a study that we're doing. We're taking people with MS. We come in, we test their balance. Then we put them on a stationary bicycle and have them ride as hard as they can for 20 minutes, which heats them up. And we test their balance again. And not surprisingly, their balance is much worse. Then we have them come back again and we test their balance and we put them on the stationary bike. But this time we give them a cooling vest to wear while they're on the bike so they don't heat up as much. And to no one's surprise, except the patient sometimes, their balance is much better. Okay. And I happen to know that the MSF has a wonderful, wonderful program for getting people cooling vests. And if you haven't already taken advantage of it, I urge you to do it. We're also about to publish a study which has shown that people with MS, when they wear cooling vests, can walk longer distances than when they don't wear cooling vests. So the simple expedience, the simple measure of cooling yourself off can result in better physical performance. Okay, and this is something that I've seen in my clinical work over the last 30, 40 years, and now we have research evidence to prove it. Another study that we're doing right now is looking at high intensity interval training. And this is really interesting. We're having patients with MS and they come in and they're put into one of two groups. In one group, we just have them walk for 20 minutes nonstop at whatever comfortable pace they can. So it's walking for a long time, but very gently. In the other group, we have them do high intensity training, which is this: they walk as fast as they can for 30 seconds. Then they sit down and rest for 1 minute. And they do that for 20 minutes. So both groups exercise for 20 minutes. The one is doing it continuously at a gentle pace. The other group is doing it intermittently, but at a very fast pace. At the end of 8 weeks of training, what we found so far is, not surprisingly, both groups improved. But the group that did the high intensity training improved so much more. So much more. And not only did they improve in their walking distance, but their balance improved. And not as important, but it gets everyone's attention, the group that did the intermittent training had more weight loss. Okay. So there's a real interesting paradigm shift that's happening in MS and exercise. I remember 30, 40 years ago, a lot of doctors would never refer persons with MS to physical therapy because they thought the exercise would lead to an exacerbation. And that was proven to be false, but still it was thought persons with MS should not exercise that aggressively. And what research now by myself and others is showing is that actually persons with MS not only can exercise really hard, but probably should. And they'll get the best benefits from it. We finished a study a little while ago looking at high intensity training where we had our MS patients lifting really heavy weights, 90% of their 1 rep max, but they would just do a few repetitions with long recoveries. and their improvements were quite significant. So it's not just that persons with MS should exercise, but they could probably be exercising much harder than we thought.
I think that PT is just another form of medicine, and you can like correct me if I'm wrong, but I just feel it's interesting to know that doctors did not recommend it for patients 30 or 40 years ago because it's like, would you not give them Lemtrada or a form of
Or
medicine they have to take?
well,
It just seems like if
it
we're
was
taking,
thought,
I'm
it was
sorry.
thought, sorry, it was thought at that time that exercise could lead to an exacerbation. And the reason behind that was it sort of did. It led to something called a pseudo exacerbation.
Mm.
So persons would exercise really hard, they would heat up, their symptoms would get worse. But that's not an exacerbation. An exacerbation refers to an acute demyelinating event. And what happens when you exercise too hard, you don't demyelinate, your nervous system heats up and it blocks axonal conduction. But as soon as you cool off, it goes back to normal. So not as much was known about MS back then. There's more known now. And persons with MS should take advantage of this new information. But you referred, Kimani, a few minutes ago to MS being a type of medicine. I mean, to
Or
physical therapy being a type of medicine. And I just wanted to comment on that. A good physical therapist should use exercise in the exact same way that a physician uses medicine. So when you want to match the exercise to the patient's specific need. If a patient comes to a doctor and says, I feel sick, the doctor doesn't say, well, here's a big sack of medicine, take it and you'll feel better. No, they try to match the specific medicine to the patient's specific need and gives it to them at a specific dosage. It's the same way with exercise. If somebody comes to me for some mobility deficit with MS, I'm going to try to figure out exactly what the mobility deficit is and give them a specific physical therapy program that will address their deficit. You tailor the therapy to the individual patient. So, it's not like, you give somebody a big bag of medicine and tell them to pour it all over themselves. No, you give them specific exercises to treat their specific symptoms.
I agree. We have a question from Facebook. Her
Sure.
name's Sherry. She says, when you're sick, like having a sinus infection, can that make MS worse? Because I have a sinus infection right now and I can barely move my arms and legs.
Absolutely, absolutely correct. So when you have an infection, what happens? Your body fights the infection by producing an immune response. Okay. What happens what's the deal with your immune system with MS? Okay. So you have so when you have an infection, you're developing a your hyperactive immune system is increasing the symptoms, but also something else. When you have an infection, your the infection to fight the infection, your body has to put out more energy. Okay? You have a limited amount of energy because of the MS. So the infection is taking over whatever reserves you have. A third thing is that infections raise your core temperature. And a raise in core temperature is going to block axonal conduction. So it's actually a pretty common thing. I used to see a patient would come see me and they'd be saying, I think I'm having an exacerbation. And they call their doctor and the doctor tests them and say, no, you're not having an exacerbation. You're having a urinary tract infection. And they treat the infection and their symptoms improve.
Yeah, I imagine that it can be a little frightening because you think
Sure,
that there's some demyelinization going on and
sure.
it's like, oh no, I just have a cold. So yeah.
Yeah, very common.
Didn't realize that it was that common, actually. Thank you, Sherry, for your question. I feel like we've answered everything, because I'm not seeing any more coming in. But Dr. Karpatkin, any more research that we should know about? Anything else?
There's always research. Let's see, what else am I working on right now? So we're working on a project right now, working with persons who are often forgotten by the healthcare system, persons with MS, persons with really severe disease. They rarely get referred to physical therapy. And I think that's a mistake.
Hmm.
And so we started this study recently. As a matter of fact, the study is funded by the MSF, looking at persons with what are said to have severe disease, like an EDSS of 7 to 8. And we give them a very aggressive PT program, and it doesn't surprise me at all to see they're all improving. So one person asked earlier, I don't, feel like I'm having any issues. Should I still get PT? And the answer is yes. And the other end of the spectrum is often also true. Even if you feel that your MS is very severe, physical therapy can still be tremendously helpful. A lot of times patients actually have more mobility and more skills than they think. They just needed a therapist to help them uncover it. So let me tell you about this patient who we're seeing right now. She's wonderful. When she came in, she could not sit unsupported. She certainly couldn't stand, and she couldn't roll over on her back from sideline. She's worked with me and my students for about 5 or 6 sessions now. She can sit unsupported, with nothing supporting her back for over a minute. She is standing in the parallel bars, with just with holding onto the bars and me supporting her at her waist, and she's doing that for 30 seconds. And she's able to roll over from her back onto her side. Okay. So, and she was told, no, she's not a candidate for physical therapy. And actually, she was an excellent candidate. And again, I need to say thank you to the Multiple Sclerosis Foundation for funding this study, because it's such important work. And I'm really trying to show with this work that regardless of how disabled you may think you are from the MS, physical therapy can be helpful.
Thank you for sharing that. We have someone raising their hand, Donna. Looks like you're here. Yay. So
Yes.
go ahead, ask away.
I have one question. What is the best type of exercise besides having a light gait machine or to do for bearing your own weight? If you haven't borne your own weight for about 3 years, almost 3 years, due to the medication you're taking, back into it. Besides, I actually rented that unit to do it because nobody else told me about it, and nobody else, even my doctor didn't say anything about it. And he's a renowned doctor in New York City. I told him about it, and nobody wanted to get it except my physical therapist. He said, go for it. And I did. I'm spending all of my
Well,
pension and Social Security on this.
well,
And
first
you're
of
doing
all,
the right thing.
good on your physical therapist for that. Second, just because someone's a renowned doctor
I know. Sad.
doesn't they're going to know about physical therapy. I mean, they don't have the training in it. I'm assuming your doctor is a neurologist, yes?
Yes, specializes in MS.
Yeah, I probably know him quite well. I know all the MS
Oh,
stuff.
God. Well, he diagnosed me 30 years ago,
Ah,
but I didn't take medication.
okay. So your
Didn't
question is,
like it,
what
yeah.
else can you do besides using the light gate?
It's been good.
No, I'm sorry, Donna, what's your question?
Is that the best I can do? Will that help me?
Well,
What
the
my own weight?
advantage of the light gate, I think, the light gate is a good device. Let me explain what it is. It's basically a harness, almost like a parachute harness
It's
that the
supporting me.
patient wears, and it supports their body weight so they can walk um, without anybody holding them up. The device holds them up. And it can actually be arranged so that it can, instead of having normal weight bearing, it can reduce your weight, so you're only bearing 80% or 60% or 40% of your weight. That makes it easier. The advantage to me of a light gate, and I recommend them for a lot of my patients, is that it allows you to practice more and it allows you to practice safely.
That's what I'm
So
doing.
another one of my patients is about to get one. And the reason why is because it will allow him to practice more when I'm not there. He can get in the device and just stand and walk, take a few steps, and it just allows him to get a bigger dose of therapy. Okay? So if Don, if your goal is to improve your ability to stand and walk, then what you need to do is do lots of standing and lots of walking. And the device is going to allow you to do more. There's nothing fancy about it. It's
Mhm.
just a device that allows you to do a greater amount of work.
If you can have the time, I'm so physically exhausted after I do it that I need a day to rest. And
How
I'm
much work
doing,
is your physical therapist supervising you on it?
yes, I only do it when he's here because I'm afraid of falling. That's my main fear.
Uh-huh. You're in New York City?
Not now, I'm in New Jersey. I
Okay.
was my whole life in New York City, but I moved to New Jersey.
I don't blame you. Uh,
I
the
want to go back, but not to New York City, to one of the boroughs. There's
yeah.
nothing like New York.
So they tell me. If you may want to have, I have some really interesting research and ideas that have been done on that. And you may want to ask your physical therapist to reach out to me because if
I
you're too
will.
fatigued afterwards, okay, there are ways of limiting the fatigue so you can get a higher workload. The problem with fatigue, as you've obviously figured out, is that it keeps you from doing a greater volume of work.
Definitely.
So you may want to ask your PT to reach out to me.
Okay. And you don't mind?
Why would I mind? This is
Well,
what I do, my friend.
I know that I couldn't believe you would train them. That
Why
shocked me.
would I? Look, I'm not,
I will
I'm
tell
not,
him.
I'm not a spring chicken anymore, you know. I gotta pass this information along as best I can.
Oh, that's great. So how would he get in touch with you?
I
Well,
did just put his email
yeah,
address
have
in
him
the
email
chat.
me.
You put it, where did you put it? I'm sorry.
I put Dr. Karpatkin's email address in the chat, just in
Okay.
case
Thank you.
anybody needs. No worries. We have a question from
Thank
Mary.
you.
Thank you.
Thank you, Donna.
You-
Um, Mary wants to know if electronic stimulation helps.
Oh, it depends on what you mean by help. I have many patients who have used it and they've used it to help them with pain, and that's good. The things like the psionic sleeve or the gate right device, they use electrical stimulation to activate a muscle. It doesn't restore the strength of the muscle. It's just instead of being stimulated by your brain or spinal cord, it's stimulated by an external source. And a lot of persons have improved their ability to walk with it. So um, I'm blanking on the name of the device. It's a device that fits around your ankle and there's electrodes in it and it forces you to, the electrical stimulation makes you pull your toes up. So it helps for foot drop. Name is going to come back to me in a minute. But And like I said, it's helped a lot of people. It doesn't restore. It's like a brace, but it allows your foot to move. So there have been patients I know who've gotten the device and they've done well with it. There are other patients who got the device thinking that it was going to solve all their problems and it didn't. Bioness, yes, that's it. Thank you, Judy. I've done a lot of work with Bioness. They're a good company. But they have a much narrow, in my opinion, have a much narrower spectrum of use than they claim.
Looks like we have two questions for Janine, so I'll just take it one at a time. She wants to know what your opinion is. You talked about the vibration plate earlier, but she wants to know what you think of red light therapy, red light sauna, cryotherapy, and photobiomodulation for MS. That's one.
Those are all things that are sort of bouncing around. All I can say is there's no evidence. I try to be a scientist about this, and I really want people with MS to get better. And so if I find something that there's good evidence that it gets better, that it helps people, and and my clinical experience will confirm that, then I recommend it all the time. For all of those things, the evidence is just not there. And what I worry about is a lot of people, will see an advertisement for something and they'll say, I tried this and it cured my MS in 5 minutes. And think about it. Why would a practitioner such as myself not tell you about that? I spend most of my professional life trying to figure out how to help people with MS. I read the journals, I read everything that I can. And if something works, I follow up on it. And there's a lot of, how do we say this, dishonest characters who say, well, people with MS, they're desperate, they'll try anything. So let me put this thing out. I see somebody asking a question about the cow patch. There's no evidence. There's zero evidence for it. They make a lot of claims on the website. I get a couple calls about that every week. No evidence, and I can't see any reason why it would work. I saw somebody wrote something about the Walls protocol, Terry Walls. No evidence. I don't doubt that Dr. Walls used diet and exercise and electrical stimulation, and it helped her in some ways. But this is science. This is not storytelling. And science has a certain method. And Dr. Wall's protocol has not stood up to scientific scrutiny. I wish that it did. That would be wonderful, right? That would be wonderful if there was simply a diet you could eat that would cure your MS. Okay? I would be screaming it from the rooftops. Now, speaking of diet, imagine you take two people with identical MS, and one drank Coca-Cola and ate Cheetos and Ding Dongs all day long and never got off the couch. The other one ate a vegan diet, watched their calories, and exercised regularly. Which one is going to do better? The one that ate the good diet. Does that mean the diet cured their MS? No, it means they lived a healthier lifestyle. Okay? It would be great if these things were there. It'd be great if they worked. But you have to accept the fact that there are unscrupulous characters out there who look at your disability as a means of enriching themselves. I wish it weren't the case. Or rather, I wish it were the case that those devices worked.
Janine's second question was also, how often do patients do the high intensity workouts per week? I want to work out every day if I could, and my PT has said I do too much.
The high intensity training is done a maximum of 3 times a week and usually twice. I would not do it any more than that. I do recommend you exercise every day, but it should be relatively gentle on some days and hard on others. So here's the thing, or as Joe Biden would say, here's the deal. If everybody,
Yes.
so everybody thinks, do I have relapsing remitting MS or do I have, primary progressive? Said, no, you have Donna's MS and you have Mike's MS and you have Mary's MS. And each one of you has a different, the MS is expressing itself differently in you. Plus you have your own individual attributes. So for every patient I see, I feel like I have to invent a new therapy for them. So the exercise program is going to have to be individualized to each person. Now, you may work too hard, or it may be on some days you need to work hard, and on some days you can work easy. But all of my patients, without exception, exercise every day. No days off. So this is your medication. You take your meds every day, you exercise every day. You brush your teeth every day, you exercise every day. It doesn't mean you go all out every day, but it means you do exercise every day. Exercise doesn't mean, you're breathing hard and dripping sweat. Exercise can be, just working on your flexibility or balance. Exercise can be breathing exercises. Exercises can be meditation, but you got to do it every day.
This is great, Dr. Karpatkin. Thank you so much. We do have a few more questions that I see. I'm going to jump into the Q&A. So Leslie says, how do you feel about wearing compression tank tops and wearing a weightlifting belt around the waist for support to help with lower back pain, especially when standing?
A compression belt is definitely going to help with low back pain. And the reason why is it's putting pressure on your low back. It's basically making you stand up straighter. So for the short term, it's fine. But speaking as a physical therapist, of course, I'm going to say, don't wear the belt, do exercise. Okay. So work on strengthening the muscles of your low back. And you do that. One of the ways you can do that is what I was talking about earlier. Lie on your stomach. Okay. And then while you're lying on your stomach, try to just pick your head and shoulders up and hold it there for a few seconds and then relax and let it down. Okay. But a compression belt is a good thing. A lot of my patients use something like that. If when they're in the acute phases of low back pain, but you don't want to be wearing a compression belt forever. I would rather cure the low back pain with exercise.
Just a sidetrack. Just kind of want to go off a bit. So if someone with MS is wearing this belt, would you recommend that they wear it, like, say, if they're sitting down a lot to help with posture, or would it?
No, because the belt like that is not going to help their posture too much. I think they'd be better off like putting a pillow behind their low back to
Okay,
maintain the curve in the spine. They should be wearing it while they're walking or standing.
got it. Kim from Facebook asks, what can help with fatigue? I'm sure you get that a lot. It's a general question, not much
Oh yeah,
detail.
no, it's okay. It's a bit of a long answer, but I'm going to go for it because it's one of, I think fatigue is the most common symptom in MS. I think everybody with MS has fatigue to some extent or another. Okay, so there's two types of fatigue. There is subjective fatigue, which is a feeling of just being tired. And there's objective fatigue, which means physically your body slows down no matter how hard you try. And persons with MS can have one or the other, they could have both. There's also fatigue that's due to the disease itself, but more commonly, I see a lot of fatigue that's due to the fact that the person is deconditioned, that they're simply not active enough. a lot of persons with MS experience fatigue, not because of the MS, but because they are too sedentary. So it's a vicious circle. So say someone tries to exercise and they get really fatigued. They stop exercising. Okay. They stop exercising, so they get out of shape. So the next time they try to exercise, they get more fatigued. So they stop exercising, which leads to more fatigue. And it's a vicious circle. So in some of my earliest research looked at fatigue, and one of the things it found was that if instead of trying to exercise all at once, doing it in bursts, like exercising for 1 or 2 minutes and then resting for 3 or 4 minutes. Exercise for 1 to 2 minutes, okay, and then resting for 3 or 4. That's one of the best and easiest ways to limit fatigue during exercise.
It looks like Mike wants to know what your opinion is on HSCT. It says, will it ever be available in the US?
I'm honestly not sure what it is. What does HSCT stand for?
I'm not sure either.
Let me look it up. Hold on.
Kind of stem cell transplant.
Yes.
Here we go.
Hematopoietic stem
Oh,
cell.
stem
It
cell.
is
Oh,
actually
okay.
maybe 500 years.
Some doctors are working really hard on it, and they believe that it will eventually pan out into something. I have not, I've worked with many patients who've gone through the procedure, and I have not seen any big changes in these patients. That is not to say that it's ineffective. The people who are working with it are very serious scientists, and I think they're probably onto something. But on the same topic, let me say this. There's a lot of places that are recruiting patients to be in stem cell trials where the patients have to pay their own way. They're taking place in places like Israel or South America or somewhere else. And the patient goes through a very costly, they have to pay their own transportation, lodging, medical expenses, and they pay $25,000 for this, and they don't really get any benefit from it. The person who's doing the research, gets gets the data. But again, I would love to say that the research supports going through it. I have not seen the research reach that level yet. It may. It may. At this time, I haven't seen it. I hope it does.
Me too. We are out of time, it appears, but we got more questions in, and I'm glad about that. So if you missed any part of the conference,
You guys want to email me questions over the next couple of
yes.
weeks?
I did put your email in the chat. Bavia, if you can do it again, because that was about 15 or so minutes ago, that would be awesome. But if you guys did miss any part of the conference, it will be on our YouTube channel, Multiple Sclerosis Foundation, in a few days. However, you don't have to wait. You can go straight to our Facebook page, and when we close out the webinar here on Zoom, the live stream will be available to watch from the beginning there. Our next conference will be tomorrow, actually, with Dr. Aaron Boster. I believe it's at 6:30 p.m. Eastern Time, and he'll be closing out Pride Month, sharing some concerns among the LGBTQ plus community. We thank you so much, Dr. Karpatkin, for staying the hour and a little bit over to answer some questions. And we can't wait to see you again soon.
Same here. Thanks, guys.
Thank
Stay in
you.
touch.
Take care, everyone.